Knock, knock, knock. May I come in?
Yes.
All right, so my name is Zachary. I'm the nurse for today. Can I get your first and last name and date of birth, please?
Justin Park, November 14th, 1999.
All right, Justin. Do you have any known allergies?
No allergies.
Allergies? Okay, I'm going to check your wristband. All right. I'm going to just check your chart real quick. All right, yeah, no known allergies. So, what brings you in here today?
Some pain in my right ankle.
Okay, so you got some pain in your right ankle. How did that happen?
From basketball.
So you're playing basketball. So it's in your right ankle. Is your pain radiating at all anywhere?
No, just in my ankle.
Just in your ankle? Okay. So on a scale from 0 to 10, 0 being no pain, 10 being the worst imaginable, how would you rate your pain?
I would say it's like a 5 right now.
It's about a 5. Is a 5 manageable, or would you like it to be lower?
5 is pretty manageable, but I would like it to be at a 3.
Okay, about a 3. All right, so we can definitely help you out with that. I'm gonna ask you a couple questions before we get started, okay? Can you tell me what day of the week it is?
Wednesday.
Okay, can you tell me where you are?
Concordia Hospital.
Concordia Hospital, and can you tell me when the next upcoming holiday?
Valentine's.
Valentine's. All right, perfect. So patient is alert and oriented times 4. No abnormal speech or unnecessary movements. So now I'm going to go ahead and get started with your head-to-toe assessment. It's going to take about 15 minutes. Are you comfortable where you're sat?
Mm-hmm.
Okay, perfect. All right, so first I'm going to check your back for any skin breakdown or pressure ulcers. Okay, none there. I'm going to check your coccyx for any skin breakdown and pressure or ulcers. Okay, none present. So now I'm going to check the top of your head for any alopecia or skin breakdown in your scalp. Okay, none there. I'm going to check the back of your ears for any skin breakdown. None on your right side, inside the ear. Okay, no excessive signs of cerumen. Check your other ear. Okay, no skin breakdown at all. Inside, no excessive signs of cerumen. So now I am gonna check your temporal pulse. Okay, temporal pulse is equal, bilateral 2+ and regular. I'm gonna check your temperature. Okay, temperature is good. I saw on your chart that it was 98.8 earlier. So now I'm gonna go ahead and do your 6 cardinal fields of gaze. So I just want you to look at the pen, okay? Don't move your head at all. Okay, perfect. So now I'm gonna check your pupils. So I want you to look at the wall behind me, okay? All right. So your pupils are 4 millimeters, equal, round, reactive to light, and accommodating. So now I'm gonna check your nose for skin breakdown. All right, no skin breakdown on your nose. Can you tilt your head back for me? Okay, looking in your nose, no signs of excessive mucus. Can you open your mouth for me, please? Okay, all right. Oral mucosa is pink and moist. Can you stick your tongue out too? All right. Tongue is symmetrical, pink and moist, no signs of thrush. Notice all your teeth are intact. Do you have any missing teeth?
No missing teeth.
No missing teeth. Do you have dentures?
No dentures.
No dentures, perfect. Okay, so now I'm gonna check your carotid pulse. Okay. All right. right, carotid pulse is equal bilateral, 2+ and regular. Do you have any problem swallowing?
No problems.
No problem swallowing? Here, can you go ahead and swallow for me? Okay, perfect. No signs of tracheal deviation. I'm gonna check your, first, any skin trigger, okay? Okay, no skin trigger. No tenting, which means there's no signs of any dehydration. I'm gonna rub my hands down your arms, okay? And tell me if you have equal sensation, right? Equal sensation on both arms, perfect. I'm gonna check your brachial pulses. All right, brachial pulse, equal, bilateral, 2+ and regular. I'm gonna check your radial pulses now. All right, radial pulses equal, bilaterally, 2+ and regular. Can you stick your hands out like this for me, please? I'm gonna check you for your capillary refills. Okay. Capillary refill is less than 3 seconds on all 10 digits. Can I have you? I'm gonna test your strength now. Okay. So put your hands up against mine and push. Okay. Go ahead and pull. Perfect. And squeeze. All right. Perfect. 5 out of 5 strength on all upper extremities. So now I'm gonna go ahead and I'm gonna listen to your lungs. Okay. All right. So go ahead and take a deep breath. And out. All right. In. Out. In. Out. In. Out. In. And out. And lastly, in and out. Okay, so your lungs are clear to auscultate bilaterally on the anterior side. I'm gonna go ahead and do the same to your back, okay? Alright, go ahead and take a breath in and out. 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 Okay. Your lungs are clear to auscultate bilaterally on the posterior side. So now I'm gonna listen to your heart, okay? Alright, so S1 and S2 sounds are present. I'm gonna go ahead and listen to your apical pulse. It's located on the midclavicular line between your 4th and 5th intercostal space. I'm going to do that for about a minute as well. Okay, so your apical pulse was about 80 beats per minute. I also went ahead and checked your respirations. That was about 16 breaths a minute. So now I'm gonna go ahead and continue with the rest of my assessment. So can you tell me a little bit about your diet? So what do you normally eat in a day?
Usually like meats, vegetables, and like rice.
Okay, so it sounds like you have a good balanced diet. How about water? How many cups of water do you drink a day?
I drink about like, I'll say like five
Five cups? Okay. So we do recommend our patients drink at least 8 cups of water a day. Do you not like the taste of water?
I don't really like tap water.
Tap water? Okay. So there's quite a few things you can do. There's the flavor enhancers like Mio. So you can add that to whatever water you are drinking, so you can make sure you're getting at least 8 cups a day. How about bowel movements? Like how often? When was your last bowel movement?
Last night.
Last night? Okay. About how many times a day? How often do you?
Usually like once a day.
Once a day? Okay, that's good. Do you remember what the consistency was like?
It's like soft brown.
Soft and brown?
Yeah.
Okay, that's good. That's good. How about urinating?
About like 5, 6 times.
5, 6 times a day. Do you struggle to urinate at all? Is it painful or anything?
No.
No pain. Any strange odors?
No strange odors.
No strange odors. Okay. So I'm gonna go ahead and continue on with the assessment. Can I go ahead and have you lay down, please? All right. And if you could you lift your shirt up for me? I'm gonna go ahead and listen to your bowel sounds. All right. Starting with your right lower quadrant. Okay, I'm going to move to your right upper quadrant. Okay, moving over to your left upper quadrant. Okay, and now your left lower quadrant. Okay, all right. So your abdomen is clear to auscultate. I did notice that no signs of any skin lesions or enlarged organs. So I'm going to go ahead and palpate lightly. So that's about 1 to 2 centimeters. Starting with the right lower quadrant. Okay. All right, upper quadrant. Left upper quadrant. And left lower quadrant. Okay, so no signs of any enlarged organs, no skin tenderness. I'm gonna go ahead and palpate deeper now, about 4 centimeters. And if any time, just let me know if there's anything that's painful, okay? Alright, left upper quadrant. And left lower quadrant. Alright, perfect. No signs of no tenderness or anything at all? Oh, okay, perfect. Found no signs of bowel enlargement or anything like that. I'm gonna go ahead and palpate your bladder, okay? Okay. No hardness of your bladder felt, and no bladder distension. You can go ahead and sit up for me, please. I'm going to continue with the rest of the assessment. Okay. So I'm going to test your strength of your extremities. Can I have you lift up? Okay, perfect. Can I have you push out? Perfect. Can I have you pull in? All right, wonderful. And then for your feet, can I have you push up? All All right. Push down like a gas pedal. Perfect. All right, so 5 out of 5 strength on lower extremities. I'm gonna go ahead and look at your popliteal pulse, okay?
So I'm just gonna take off my gloves,
Thank
wash
you.
my hands here. Do you have any questions for me at all?
Okay, so your popliteal pulse is a little weak, but that's all right because I'm gonna continue down. I'm gonna take your anterior
Have a great rest of your day.
tibialis pulse.
That was
Okay,
great.
that is
That was really good.
equal, bilateral, 2+ and regular. You can go ahead and do your dorsalis pedis pulse now.
You just sounded a lot more confident. You
Even
did
in the
more.
beginning when
Yeah,
I
no,
said
even in the
sir,
beginning.
and then I thought zero.
All right, your dorsalis pedis pulse was equal, bilateral, and 2+ and regular.
I think that's better. I mean, you can go over both of them.
So now I'm gonna test your range of motion for your lower extremities. Can you stand up for me, please?
There was like a few things that I learned.
So hold on to the side of the bed.
Like very.
So go ahead and lift your right leg up like this.
It was like I don't think that you
Pull it back.
mentioned, like retarding organs.
Perfect. Now same thing with your left leg. So lift it up. Pull it back.
Did you guys like
Perfect. All right. So full range of motion for the lower extremities. And that concludes your head to toe assessment. I noticed on your chart that the doctor prescribed 400 milligrams of ibuprofen. So go ahead and take that, and we'll do a second or follow-up checkup in about 2 weeks. Thank you.